Okay, actually, before I go, what is going on? Why am I so dark? Okay, before I go, I want to respond to a YouTube message I got from Shane Paul. And I've been meaning to respond to you for a while, so please don't think that I've ignored you. I'm so scatterbrained and just like ditzy. I don't, you know. Okay. And I don't know if you saw my other videos to Cobb, but I'm lazy. I don't like writing out long letters, so I usually try to respond in videos. So, yeah. Um, don't worry about the delay it took, for you to get back to me, because obviously there's also a delay in me getting back to you. And it's not because my laptop gave up on me, it's just because I'm lazy and don't think. I don't know how I've stayed clean. Well, the one thing that really, really, really kept me clean in the beginning is knowing that I would just waste my money. I would waste good money and good dope, I wouldn't be able to get high with the methadone. And maybe it would work, but just the risk of, like, not only the risk of not getting high, but the risk of not providing a clean sample and crushing everyone around me that was rooting for me so hard. And at that point, I wasn't rooting for myself, but of course now I am, so now that's what keeps me um, providing clean samples. Okay, you say you're unfamiliar with the U.S. medical system and exactly what support is available to me. Um, okay, the medical system here, I don't know, I'm not educated on that, but I don't have any insurance, and the methadone clinic doesn't rely on insurance or medical plans or anything like that. We just pay out of pocket to go to the clinic, and the clinic used to provide medical our clinic used to provide medical care. If we had a cold or whatever, we could see the doctor there and they could prescribe us something. Now, our clinic doesn't do that anymore. So, yeah, basically all that comes along with being at the clinic now is the counselor. We get to see a counselor, once a month or whatever. And yeah, I don't, it's cool. Fuck it. I hate seeing my counselor. I'm not gonna lie. I can't stand it. I hate it. And it's not because I don't like her. It's because we have to sit in this little room, and the room is so small. And it feels like it's closing in on me, and I just can't even talk about it. It makes me so crazy. I hate seeing my counselor. But yeah, so the, um, that's about all I know about that. You say, how strict is your drug screening process? Are you taking your methadone under supervision? Yes. We have to take our methadone under supervision every day, except for take-homes. But I go to the clinic 5 days a week, and you have to dose inside of a small room where it's just you and the nurse. So it's definitely supervised. The drug screening process, we get urine tested. For the first year, you get urine tested once a week. Past that, it's once a month. So right now, I'm on once a month. Am I taking any other medication? No. I'm not taking any other medication. When I was admitted to the, when I, what, not admitted to the clinic, but when I first went to the clinic, I was taking Klonopin, a benzodiazepine, and of course they, said I absolutely cannot take that anymore. So, no, I'm not taking anything else. You say, are you able to be admitted to hospital for reduction of your methadone intake? No. Basically, what they do is they taper. Like, for example, right now, I tapered 10 milligrams. So, it's usually you go down 5 milligrams per week, and that's how you do it. Of course, if someone was complaining of sort of symptoms or something like that, I'm sure they could be admitted to the hospital, but the hospital and the methadone clinic here have a strange relationship. Like, if I were to be admitted to the hospital right now for something totally unrelated to methadone, there is not a guarantee that they would give me enough methadone that I need to remain at a functioning level. Yeah, there's a very strange relationship between hospital and methadone clinic here. I can transfer to Subutex. Basically, they say that you have to wait for 5 days, or no, Suboxone. I can transfer to Suboxone. And I have to wait 5 days, be off of methadone for 5 days before I go on the Suboxone because, um, you know, there's some issues. You know, it'll send you into rapid detox. I see that you say in the UK the authorities will not support a transfer from methadone over onto Subutex until you are down to at least 40 milliliters a day. Yeah, yeah, that's pretty much how we are too, but they you know, just, we do it in a different way. Let's see, our screening process in the UK are fairly forgiving. As I reduced my methadone, my uses of street heroin increased. Woo. I mean, what are you saying, that as you reduced your methadone, you started doing dope again because you weren't feeling good, or you just wanted to start doing dope again? Because I was scared. I'm scared of, you know, getting down to a small milligram and being so sick that I have to find something to supplement, you know? I'm really, really worried about that, like getting down to like 20 or 30 milligrams and feeling sick and thinking, oh God, I've got to go out and get something that makes me feel better. That's really frightening to me, and that's probably the scariest aspect of trying to detox. But at our clinic, if you fail a drug test for opiates, more than once, you're out of there. They're pretty strict. They don't keep patients around if they're not going to do what they're supposed to do. And I kind of like that, you know? I kind of like that. It keeps people from really abusing the program. But I think it depends on the patient, to be honest. Like, you know, if they can see the patient is really trying and really struggling, I'm sure they'd be lenient on them. But there are a lot of patients at the clinic who are trying really hard, but there are even more who are hardly trying. So I really think it's on a per patient basis. Like with me, they're very lenient because I do what I'm supposed to do. I can't pay every week. I pay every 2 weeks, and that doesn't bother them because I've never, you know, I do what I'm supposed to do. And I think if there was a patient that was more trouble, they'd probably kick them out on their ass a lot quicker than a patient who was really trying. Yeah, I definitely know it's easier to transfer from heroin to Subutex. Yeah. Yeah, I used to, like, if I just couldn't get dope, I would get a Subutex. You know, I'd get a Subutex sometimes, but I, yeah, when it comes to withdrawing from using acquaintances, that's so true. You have to stay away from people who are involved in that lifestyle, so the temptation goes away. Yeah, I've been on it 1 year, and I'm detoxing now. Um, yeah, I was on heroin for over 4 years, so yeah. Sorry, this is so scattered. Like I said, I like to communicate via video. I'm so lazy typing, and I make less sense typing than I do talking. But yeah, I'll give you some. I'd like to stay in touch with you. I've never talked to someone who knew about the methadone, who was involved in the methadone program from the UK, so that's really cool. But yeah, definitely stay in touch, and I'll make another video to you pretty soon.